This is the advanced directive section. So this is where you have the healthcare proxy names, their primary proxy and their alternate proxy. If for some reason these names aren't actually the proxies, if the proxies are somebody else, you click here saying healthcare proxy is different. But in most cases, these will be the proxies. You can add other contacts as well for the patient. This is the exhaustive list of advanced directives, whether you should intubate, whether you should send them to the hospital, whether you should give them blood transfusions, antibiotics, hydration, anything. They're all listed here, and they can be filled out. There's other advanced directive information. In other words, do they have a MOLST form? Has this been signed by the patient, by the physician, by a nurse practitioner? What are the dates, effective dates on the form? So you can use these. It doesn't replace the legal document, the MOLST form, because it really isn't legal. It's really just a way of conveying the patient's wishes and the fact that there is a MOLST form that someone can refer to. So it has value, but it's not quite legal to replace the MOLST form in Massachusetts at this time. Chief complaint, that's an easy section. It's all free text narrative, just one big box that you can just type whatever you want in. And so this is the sort of the reason why the patient came in here. What was their main reason for being admitted here in the first place? History of present illness. Again, just a free text box. This is where you can kind of summarize the care that you gave. This is what we've done. This is also, if you're doing an SBAR, an Interact SBAR, do you guys use the Interact SBAR?
Yeah.
Right. So if you want to do the Interact SBAR using this, you could, in the history of present illness, you could say, okay, well, this is what's been going on with the patient. They've been more confused lately. They've got a little bit of a fever and cough, and didn't eat supper. And this is very unusual for her. You could enter that stuff here, just sort of a free text discussion about what's going on, and that will help convey the information to the nurse practitioner or physician or whoever you're contacting with the SBAR. And the nice thing is, if you do this for your SBAR, then, in other words, use C to fill out your SBAR. Well, first of all, a lot of the information's already been there because you can get it from the hospital. And also, if you have to send the patient to the emergency room, you're almost done. Because it's all here, it's all ready to go. Just fill in any additional information that the doctor said, blah blah blah, and send it. So it may be efficient to do your Interact SBARs using C. Encounters. This is just a list of visits that have taken place. If you've had some consultants come in here, this may be an useful place to list, that you've had various consults with a podiatrist or whoever. You can put that in here. You can put in when they were last seen in the emergency room or how many visits they've had in the emergency room. I'm not sure how much that's going to get used. Problems and health concerns. This is the problem list. So this is where you list all the problems that you've been dealing with for the patient. You click Add to add a new problem. Just that simple. Also, this is where if they have mental health diagnoses, these are the DSM axes, can be filled in here as well. If they have a life-limiting condition, if there's a greater than 50% chance of death in the next 2 years, there's a little box to check that. And really the purpose of this is to get people to start thinking about advanced directives. And have you had an advanced directive filled out on this patient? This sort of gets you thinking, oh gee, maybe I ought to. And in fact, if I would not be surprised that that I heard that my patient died, I really need to be thinking that I need to get these advanced directives in place. Other sections in the problems, and if you click on that Add a Problem, it will pop up a box that looks like this. You can put in the problem name, which it says here, the problem name is required. So you can type in the name, and it'll bring up a whole list, because we have all sorts of, there's a few thousand diagnoses in here that you can pick from. But if you don't find it, just type in the name that you want to use. Dropsy, good, put Dropsy in there, whatever you want. That's okay. You can optionally put on the date that it started or the date that it resolved if it was done, how severe it was. But again, these are all optional. Just the most important thing is you need to have the name in there. When you're done, you click Save Changes, and it saves the changes right back to the problem list. History of past illnesses, this is just, prior problems that they've had that maybe aren't relevant right now. Maybe they've had gout in the past, maybe they wanted to make sure people knew that so that they don't get a diuretic or something that'll bring their gout back. You can list that in here. Or and you can do it as, click add and list it as discrete, just discrete problems. Family history, that's all free text. You can put in whatever you feel is relevant. Social history, there's a lot of stuff in social history. And to be honest, we couldn't figure out where to put it. It ended up in social history. So this is where it's sort of a big mix of different things. So for instance, we've got patients' likes and dislikes. So maybe you've been doing some therapies on the patient. They've been doing exercises or games or something, and you wanted to say, she loves to do this ball game, or catch the ball, or loves to do some knitting. Put it here. This is great. This is something that may be useful for the next person who's caring for this patient. Patients' expectations of care. Patients' religious and cultural issues. Maybe they're Jehovah's Witness and they have specific limitations on what care that they're willing to receive. You can put that in here. Needs assessment of community support, needs assessment of family involvement in care. You can mark those off here. What are their exposures? Do they smoke? Do they drink? Do they shoot up heroin? I don't know what you're seeing there. Do they have risky sexual behavior? This is not just for nursing facilities, although I know that there is some of that going on. But it's actually, this document is really for all ages, for all conveying all types of information, even if they're going from a hospital back to home. Do they have workplace exposures? Again, maybe not as relevant in nursing facilities, but if they've been exposed to asbestos, maybe that would be recorded here. We are starting to think about recording lifetime radiation exposure. That's down here. So every time we do a CAT scan or an X-ray, they're getting more radiation. We're starting to tabulate that, and that would be recorded in this one. Here's where you record still in the social history. Remember I said this has a whole bunch of stuff. Their living situation, what's their housing status, what's their living arrangement, what's the environment that they live in? Are there risks in the environment that you have to worry about? Also, what are their home supports? Are there transportation issues? Also, if you're doing any risk scores, I don't know if you're doing any fall risk scores, but if you are, that's something that you would record here. You put in their fall risk, and you probably want to record it maybe as a high, medium, and low, because if you put in a number 4, then home health agency might not have any idea what you're talking about, what a 4 means. Maybe it's 4 to 5, maybe it's 4 to 10, maybe lower is better, maybe lower is worse. So, put something that's meaningful to the next person in these risks. Allergy section, that's where you put allergies. And you can list them discreetly here. You click the add button if you want more. Medications. So this is similar. You click add and you can put in the medication. But what's unique about this is that it also shows when they've been taking this medication. So in other words, were they taking it before they were admitted to you? During the stay that they were with you? Is this a discharge medication that they should be taking? And presumably is a current active medication, which presumably matches what they're on for discharge. And so here's the little table of contents to explain, the legend that explains what these columns mean. So when you click on the medication and you're putting in the drug information, you can check off as to whether this is something they took before they came here, or whether they've been on it, whether they're going to be going home on it. So you can fill this out as completely as you want, or as little as you want. You can put in the indication for why they're taking this medication if you choose. Immunizations, pretty straightforward. You can put in the immunization that they're on. And again, notice the example here. This is a tetanus shot. The details are at the bottom, and they're copied automatically by the system displayed over here to show this is the tetanus shot. So anything you type here is copied over to here. Medical equipment. So if they've got medical equipment, adaptive devices, quad canes or walkers or whatever, rolling walkers, those would be listed here. If their supplies, they've got a wound, they need Duoderm dressings or something, they'd be listed here. Where do they get them from? You can put that here. Have the supplies been ordered? You can check that off. Have the supplies been sent? You can check that off. So you can record a lot of information that will be helpful to the home health agencies as they're receiving your patients. Vital signs, pretty straightforward. You're putting in the height and weight and their blood pressure and the rhythm. If you put in the height and weight, if you click this calculate button, it'll calculate their body mass index, their BMI for you. So you don't have to figure out what the formula is, it'll do that for you. The other thing is, when you're putting in the height, you can type in, this is being recorded right now in inches, so you could type in 66 inches, or you could type in 5'6", and it knows that you're trying to type in 5'6", so it'll calculate that as inches for you. Be careful, weights are by default are recorded in pounds, but if you click that down arrow and click on kg, it'll start recording in kilograms, and then these may not make much sense. So make sure you're paying attention to which one you're recording. The physical exam, which also is, that's how you describe any wounds that they have, the size of the pressure sores or the stages. You put this under the physical exam, and it's all part of the free text in the narrative. Functional status, this is fairly exhaustive because it includes, you'll see, it includes a lot of different pieces. So it's got the ADLs, you could put in whether they're independent or whether they need assistance. Excuse me. How far they ambulate, are they continent, or their bowel or their bladder, when was the last time they had a bowel movement. If you're able to do it, you can write down whether they have clearance to drive. That may or may not be relevant. Also, there are other capabilities as part of functional status. Are there issues with their speech, their hearing, their vision, their sensation, their mobility? Do they have any amputation? Do they have paralysis? Do they have contractures? All of these would be recorded under functional status. Do they have issues with stairs or with doing errands or bathing? Again, all under functional status. Do they have cognitive and mental issues? What was their mental status, when they were transferred? Can they consent to treatment? Can they comprehend? Can they express their wishes? How's their memory, their concentration, their orientation, their judgment, their mood? All of these things can be recorded and conveyed, all under functional status. So functional's not just function, but it's also cognitive functions as well, not just walking functions. And then this is also, so functional status is also kind of a grab bag, just like social was. This is where you put in special alerts. So if they need supervised feeding, if they are oxygen dependent, if they're a fall risk or an aspiration risk, or have weight bearing issues, well, what's their weight bearing status? Do they have violent behavior? Do they wander? Do they elope? This is where you enter all this information. If they're having pain, you can put the pain score here. Procedures. This is, excuse me. So these are procedures that, it's almost like a plan for them. They should be getting their weights checked daily, their blood pressures every shift. They ambulate with assistance twice a day. So this is where you'll be putting in part of that plan that's, that you've got in place for the patient. Are there other treatments that they need? Do they need to be suctioned? Do they have a central line? You put in information about those lines, their PICC line or whatever. Do they have catheters? There's a whole list of treatments that you could put in here. Are they, again, under procedures? Are they getting TPN? Are they getting chemo or radiation? Do they need tracheostomy care? Fluid restrictions? Nutritional supports? So there's a whole bunch of stuff that you can put in here. And the key thing is that you don't have to fill in everything. If you did, you'll never get the patient discharged. But you put in what's important, and then we've got a bucket to put it in. Results. We have the most common results that people are interested. If they're on blood thinners, we've got their INR. If they've got kidney issues, you've got their BUN and creatinine. You've got their hematocrit for blood levels, potassium, sodium. If they've got heart failure, what the last ejection fraction was. And you can, if you click on it, it's a plus, so you click on it and you'll be able to enter another value, and you put in the date that you got it, or click now to put in today's date. But if there's something other than this that's important, maybe they've got a problem with magnesium or calcium or something, you can click on other significant labs, it'll bring up a row that you can type in calcium and put in what the value is. Now there is something called an assessment section. It's not like a nursing assessment of wounds or functional status. It's an impression. It's like the assessment and plan. It's what's your impression of how this patient's doing overall. And again, this may be something that's valuable in the SBAR. And then finally, the diagnoses. You're sending them home. These are the diagnoses your discharge diagnoses that we've treated them for, and they're listed just like the problem list would be entered. There is also a piece called the care plan. Now, the care plan permeates this whole document because there's the care plan is made up of your health concerns, your goals, your interventions, what your assessments are, what the care team is. So this is really the piece of the care plan that's not anywhere else. And so for the most part, a lot of it is just the goals. So it allows you to put in what the patient's goals are, what their short-term and long-term goals are. It allows you to record goals specific to problems, like what's your blood pressure target, what's your cholesterol target, what's your ambulation target, do you have weight goals? So you can put those in here. But there's also other parts of that you're planning. So what are the interventions that you expect them to get after they're discharged? Maybe they need a PT consult at home. You can put that in there. We're going to try to make some of the boxes a little bit larger so that they can display more information. You can type in tons of information, but they don't quite display as well as we'd like right now. Has the patient and family accepted the plan? How confident are you about the diagnoses that you have on this patient? What's the perception of the patient and family of the adequacy of this transition? Are they nervous about this? Are they comfortable? Are there any scheduled appointments that you've already made for the patient? You could list those here. Are there any particular red flag instructions that you want to give to the patient? If your blood pressure is above this, if your pulse is below this, if your temperature is this, if your weight is this, this is what you need to do. This is where you could put those kinds of things. Who's in charge of learning? You could put that here. It's the spouse. Because the husbands never know what's going on. The diet. What diet are they on? And over here is some stuff that's specific to home care. Maybe they're not going to their own house. Maybe they're going to live with a family member. Maybe they're giving, so you can list the address to where they're actually going for care. You can put in, check off that they indeed are certified for home care, what their condition is that requires that they receive home care. You can put in the date that they're supposed to be seen. Are they supposed to be seen tomorrow, the day after that? You can put that date in here. When you sent them out, were there any tests, results that aren't back yet that are still pending? You can list that as well under this care plan section. Who's supposed to follow them up? What's the phone number to call to find out the result? And what are you expecting? Again, you don't have to fill everything in, but this is a great place to record the stuff that often gets lost. Wounds, you can add a little bit more information if there's a back dressing. You can enter some of the detailed specifics about that as well. Payers, I'm not sure that anyone's going to use this section, but it's there just in case you want to put their insurance information. So you've gone through every single section, and then you're done. So there will be a button that will show you when we go live that takes you back to your webmail mailbox, and you're done. All right. So now what we're going to do is we're going to go find that document that we just went through exhaustively, we're going to go ahead and finalize it and send it. So we're going to log into the webmail mailbox because that's the only way to get to see. We're going to go find that do not delete message because you didn't delete it. We're going to and we're going to use that to get into C. Then we're going to get rid of that and go search for the draft that we've been working on. We'll go find that draft, we'll finalize it, and when we finalize it, it takes us back to C, and it actually puts that final document in the draft folder in the mailbox. So that's actually what goes into the draft folder, is that final document. We'll go find that, we're going to go then send it to where it needs to go. So again, always start in the same place, log into the webmail mailbox. You find, only thing there is the do not delete button, do not delete message. You click on the bottom here to go to C, to download that attachment, which takes you to C. It's trying to say, oh, you want to start a new document, but you don't want to start a new document, so you're going to X out of that. And now you're going to go search for the document that you were working on. Again, it's probably best to use all. Search by the patient's name, and it'll be in a draft state. I suppose in theory you could click on drafts and just search through drafts. That'll also work. And you'll find the draft that you're working on, and you'll click on it. And then you can click on whatever sections you want to update, if there's any updating that you need to do, sort of your last final thing. Maybe you want to go to the demographics and check to see if the authors have all put in that you know, the people who were supposed to be authors did enter themselves as authors, so it's ready to go. It will give you a warning. I don't have a picture of that yet. They're developing that as we speak, but it'll give you a warning saying this is the person that is using it right now. Here's the button to click if you really, really, really want to kick them out and know that you're going to get in trouble, but you can do that, or cancel them and go talk to them. And then when you're done, instead of clicking save, well, you will save a section, but next to it is the review button. So you're going to review it before you finalize it. Sort of one last chance to sort of look over and say, okay, is everything perfect? So it pops up this window that you've seen before, which has a print button on it. And this time, though, it's still in a draft form, right? Mm-hmm. And it's got a finalize button up here. And that's the one you click when you're ready to say, I'm happy with the content here, that it is complete. There's some debate, and you may want to make a policy about what that finalizing means, because the person who finalizes it has their name sort of embedded in the document as the person that signed it. And that signature, in most cases, is really acknowledging that all the pieces are there, not necessarily that every piece is perfect. That's something you may just want to make a short policy as to what the meaning of it is, that everyone is comfortable clicking that button. The fact is, it's just like paper. When you sign something that multiple people have been working on, there's a certain amount of trust, and everyone's doing their best. So you finalize it, and when you click that button, it turns it to final. And now it's done. It's carved in stone, can't be changed. You can print it. You can create a new document if you want. But what you're going to do is you're going to click on the send button, and that's how you're going to send it. And then it takes you back to webmail. And if you go look in your drafts folder, because it's a draft now, it's a draft message. And if you click on it, you'll see here's the document you just created is right there. It's a final document. It's already attached to this message. So all you need to do is just address that message to tell it where to go. So from the webmail's thinking, webmail really doesn't know that much about C. It thinks that you sort of started working on this message and now you want to finish this. So you're going to continue editing the message. So you're going to click on the continue editing button to finish editing this message, basically putting in who it's going to go to. So you click on continue editing, and then you're going to put in an address in the to field. So this is like any other message. It's got the subject line, the message that you're putting in here, any attachments. It's already got the attachment that you just created in C. And there will be another button that I don't have right now. This is going live, I think, this week. The ability to go look up into the provider directory for the state and see all the different organizations that are live. So you'll see the 16 sites in central Massachusetts that are live. You'll also see Mass General Hospital and Bay State, and a whole bunch of others. What's important is that if you don't see them in the list, you can't send this to them. So we're going to be giving you a list of the organizations in central Massachusetts who are going live, so that if you're sending a patient to Milford Hospital is not today on this. Don't go bother filling this all out. I mean, you can. You certainly can. You can print it out and you can send it with them to Milford Hospital, but don't expect to be able to send it electronically. And so that's a decision you need to make. After using this for a while, you may say, oh, this is actually pretty good. I'm going to use it for an electronic process, and even just to store the stuff for anywhere that they're going, and I'll just print it and fax it or whatever if they're not listed in here. You don't have to put in a subject or a message, but if you want to be cutesy, feel free to do that. You know, they may not even ever see what you put in there, so I would not have a lot of hope as to what you put into this messaging area. If there's someone who uses webmail and C, they will see this. If it's my organization where I use land, I'm not going to see it. So that's why don't put anything really important there. And then after you've entered the address, you click the send button at the bottom, and that sends it. And you're done. Okay. Now to start a brand new document, I'll just quickly go through this. This is pretty straightforward. It's going to use the one that says use to create a new document. And I'm going to show you how you forward it back to yourself if you accidentally delete it. So let's do that. So I log in, I go ahead and I see this is the one that I want. Okay, and I panic. Instead of clicking on the download here to create a new document, I hit the delete button. And what happens? It goes into the trash. Not a big deal. Here's the message we deleted before, your hospital transfer summary that you got in the first place. And here's this new one that we weren't supposed to delete that I accidentally deleted. So I click on the forward button, right? It's not reply to all, it's forward. And I forward it to myself. So I take, here's my direct address. This will have your nursing facility's address here. You basically highlight that, copy it, and paste it in here. Or you can type it if you want. It's a lot of letters. Okay, so we send it now, and now it's back in our mailbox. And we want to create a brand new document from scratch. So we click on the attachment here for this blank document, and we click on the part that we want to go to the C, and voila, this time we really do want to create a new document. It's been trying all the other times to allow you to create a brand new document. This time is what you actually do want to do that. And it's telling you patient's name is required, so you put that in, you put in all the required information, fill out all the sections you want, and you can do whatever you want with it. You can finalize it, you can print it, you can continue to work on it as a draft. And then the only other thing I want to show you is just if you were to be dealing with two documents at the same time, you need to, instead of pushing from a document to create a whole new one, you need to pull it into the draft one you're working on if you're just going to pull in a section. But you can only pull from ones that you've got open. So you need to open, so let's say you've got the hospital summary, and let's say you did pull in the MDS. You need to have both the hospital and the MDS open, as well as your new document that you're working on, so that you can be in your new document and pull a section from one of the other ones that's open. And so you'll find the other one that you want opened, and you'll see, so here's the new document I'm working on, and here's the one I'm going to pull from. And when you click on that copy from button, it gives you a list of all of the documents that are final, that are open, that you could copy from. So in this case, there's only one that's open, that's final, that you could copy from. It's listed here, and you click on that and say, yep, that's the one I want to copy the functional status section from. And it'll pull in just that functional status section from here into your draft document. So that's what that copy from button is for.